Welcome to the latest edition of Cardiovascular Updates, covering breakthroughs in the past 2 weeks, brought to you by Lucid Quest. The European Union is moving toward a coordinated cardiovascular health plan across prevention, early detection, better care pathways, data use, equity, and environmental risk reduction. Actions highlighted include Jacadi implementation, tighter air quality limits, heat health plans, and regulation of nicotine products. Implication: these policies could shape practice and payer discussions, with impact driven by design and execution. Relief Cardiovascular completed the first in-human implant of a pressure-guided active valve in the vena cava within a feasibility study in Georgia. The system pairs continuous hemodynamic sensing with adaptive decongestion therapy, aims to reduce preload and improve renal vein flow in diuretic-resistant heart failure, and syncs data to the cloud nightly. City University of Hong Kong secured support to advance so-called DNA surgery genome editors toward the clinic. The program uses high-fidelity nucleases and enhanced lipid nanoparticles for somatic DNA correction, with IND-enabling studies and investigator-initiated trials planned for liver and cardiovascular genetic diseases. In the Seoul Cardiovascular Outcomes Trial subanalysis, among 9,650 adults with type 2 diabetes and cardiovascular disease or chronic kidney disease, oral semaglutide reduced major adverse cardiovascular events with a similar directional effect, whether or not patients had peripheral artery disease, with the greatest effect in non-PAD. Major adverse limb events were reduced versus placebo, noting statistical limitations and pending full data. Taho Pharmaceuticals filed a US FDA new drug application for TAH3311, an apixaban oral dissolving film built on its TDS platform. Designed for stroke survivors, older adults and others with dysphagia, the film aims to improve convenience and adherence while lowering aspiration risk, and the company is pursuing partnerships. In primary prevention, Amgen reported that evolocumab, added to standard lipid-lowering therapy, significantly reduced major adverse cardiovascular events versus standard therapy alone in the 12,000-plus patient VESALIUS-CV trial. Participants were high risk without prior myocardial infarction or stroke. Median follow-up was about 4.5 years. Dual primary endpoints were met, no new safety signals were observed, and full results are planned for AHA in November. The FDA cleared first-in-human testing of UCLA's ENPP, one targeting monoclonal antibody, ADNP1, to enhance tissue repair after injury. The academic program, supported by public funding, reported preclinical efficacy in mice and non-human primates, and seeks to modulate energy pathways to aid regeneration in the heart and other organs. AstraZeneca announced that Baxdrostat met the primary endpoint in the Bax24 Phase 3 trial in resistant hypertension. In a randomized, double-blind, placebo-controlled 12-week study, Baxdrostat 2 mg once daily, on top of standard care, produced a statistically significant and clinically meaningful reduction in 24-hour ambulatory systolic blood pressure versus placebo, including morning hours, with safety consistent with earlier Bax-HTN findings, and an AHA late breaker is planned. Stay ahead in cardiovascular research, like, share, and subscribe for our updates. Visit lqventures.com or email us at info@lqventures.com for expert